Do you wake up every single morning and your mouth feels like you swallowed a handful of sand? Your tongue is stuck, you can't swallow, you need water just to say good morning? If that's you, listen up. Because what your family is brushing off as just getting older could be your body sending you a very serious warning. And most doctors are missing it completely. Stay with me because in the next few minutes I'm going to show you exactly what that dry mouth is hiding and why it matters far more than you think. My name is Dr. Eleanor Mercer. I've spent over 12 years working directly with adults over 60, and I can tell you with complete confidence, dry mouth is one of the most overlooked, most dismissed, and most dangerous symptoms in senior health today. In this video, I'm going to give you 5 things most doctors never explain about dry mouth. I'm going to tell you 7 specific warning signals your body is sending right now, and I'm going to give you a clear, simple action plan you can start using today. No complicated medical jargon, no fluff, just real information that could genuinely protect your health. Important note before we go further, everything I share in this video is for educational purposes only. This is not a substitute for a conversation with your own doctor. If something I describe sounds familiar, please bring it to your physician. You deserve to be heard, and this video will give you the words to make that happen. Now, let's get into it. Point 1. Saliva is not just spit. It's your body's first line of defense. Most people think saliva is just there to help you chew. That couldn't be more wrong. Saliva is one of the most powerful protective fluids your entire body produces. It contains more than 700 different proteins, enzymes, and natural antibacterial compounds. Think of it like a security guard standing at the front door of your health. When the guard disappears, the door is wide open. Here's the scary part. Every night while you sleep, tiny particles of bacteria from your mouth get breathed into your lungs. This happens to everyone. It's completely normal. But in a healthy mouth, saliva neutralizes those bacteria before they can go anywhere dangerous. When your mouth is chronically dry, those bacteria travel freely, every single night, straight into your lungs. A major study published in 2021 by researchers at UCSF followed over 12,000 seniors. The ones with confirmed dry mouth were nearly 3 times more likely to end up in the hospital with a serious respiratory infection within 2 years. 3 times the risk, from something most people dismiss before their first cup of coffee. I want you to type something in the comments right now. Write yes if you wake up with dry mouth most mornings. Just yes or no. You'll be shocked by how many people watching this right now have never mentioned it to their doctor, not even once. Point 2. Your medications may be quietly destroying your salivary glands. This is the one that makes me the most frustrated, because it is so preventable and so rarely discussed. Here's the reality. Over 500 medications sold in the United States list dry mouth as a known side effect. Blood pressure drugs, allergy pills, antidepressants, bladder medications, sleep aids, diuretics, the list goes on. Now, if you take one of those, you might notice a little dryness. Annoying, but manageable. But what happens when you're taking 3, 4, or 5 of them at the same time? The damage doesn't just add up, it multiplies. Research from the Journal of the American Dental Association in 2023 found something alarming. When seniors take 3 or more of these medications together, the suppression of saliva doesn't triple. It can increase by 6, 7, even 8 times. Scientists call this the compounding xerogenic effect. Most patients have never heard those words. Most doctors don't bring it up at prescription reviews. Let me tell you about Robert. He was 68, a retired firefighter from Atlanta, tough as nails. When he started waking up with a bone-dry mouth every morning, he did what strong men often do. He pushed through it. 2 full years went by. Then his dentist found 8 teeth destroyed by decay in just 14 months. She had only seen numbers like that in patients who'd gone through radiation treatment. She asked the right questions. Robert's acid reflux medication combined with his blood pressure diuretic had been chemically stripping his mouth of protective moisture for 2 solid years. A bacterial culture came back off the charts. His cardiologist later found early arterial inflammation directly linked to the bacteria spreading from his mouth. A dentist asking one question about dry mouth is the reason Robert is still here today. Type in the comments, how many prescription medications are you currently taking? Just the number. Because if that number is 3 or higher, what I'm about to say next is especially important for you. Point 3, you can eat 3 meals a day and still be slowly starving. This surprises almost everyone I tell it to, so I want you to really sit with this one. Saliva doesn't just break down food in your mouth, it sends chemical signals to your stomach, telling it to start producing acid and digestive enzymes. Without those signals, your stomach is unprepared. Nutrients pass through your body without being properly absorbed. Think of it like trying to cook a meal without preheating the oven. You put the food in, you wait, but nothing really happens the way it should. A 2022 study from the Mayo Clinic found that 44% of seniors diagnosed with unexplained malnutrition, meaning doctors couldn't figure out why they were losing weight, had significant dry mouth that had never been identified as a contributing factor, nearly half. So if you've noticed unexplained weight loss, fatigue that doesn't make sense, clothes that fit looser than they used to, don't just assume it's aging. It may be that your body is not absorbing the nutrition you're giving it because your saliva is not doing its job. And here's what frustrates me as a doctor. This is so easy to screen for, but nobody asks. Stay with me because we're about to get to the 7 specific warning signals, and these are the ones you actually want to write down. Point 4. Bacteria from your dry mouth can reach your heart and brain. Your mouth is home to over 700 species of bacteria. Under normal conditions, they live in a careful balance regulated by saliva. When saliva disappears, the dangerous ones take over fast. We're talking about bacteria with names like Streptococcus mutans and Porphyromonas gingivalis. They thrive in a dry environment, and they don't stay in your mouth. Research published in Nature Reviews Microbiology in 2023 showed that these bacteria enter the bloodstream through tiny, invisible breaks in your gum tissue. Once they're in your blood, they travel. They have been directly linked to infections of the heart valves, worsening of diabetes, faster cognitive decline, and in serious cases, sepsis. Here's a simple way to think about it. Imagine a crack in a water pipe in your kitchen wall. Small crack, nothing dramatic. But over months, water seeps through, and one day the wall collapses. That's what's happening in your mouth every day it stays dry and unprotected. A 2023 Johns Hopkins study looked at over 8,400 men between 65 and 75. Those with high levels of oral Streptococcus mutans had a 34% increased risk of a major cardiac event within 18 months. 34%. You are not powerless against this, but you need to know it's happening first. Point 5. Dry mouth is almost never just one thing, it's a signal. This is what I want every person watching to take away. Chronic dry mouth by itself is rarely the real problem. It is your body's way of pointing at something deeper that has not been diagnosed yet. Let me tell you about a woman named Gail. She was 73, retired librarian from Portland, Oregon, quiet, organized, the kind of person who kept a journal of every symptom. She came to me after 18 months of waking up with a completely dry mouth. 2 different doctors had told her it was just aging. When I sat down with Gail and went through her history, I found something none of the other doctors had asked about. She had been waking up 3 or 4 times every night to use the bathroom, and her eyes felt scratchy and dry most of the day. That combination, dry mouth, dry eyes, frequent urination, is not aging. It is a cluster of symptoms pointing at 2 very specific, very treatable conditions. In Gail's case, early Sjogren's syndrome, plus a blood sugar issue that had quietly been building for over a year. She had been dismissed twice. I referred her to a rheumatologist and an endocrinologist the same week. Both diagnoses confirmed within 60 days. Gail told me later, I knew something was wrong, I just needed someone to believe me. That is why I make videos like this. Because you deserve to have someone take your symptoms seriously. The 7 warning signals, write these down. Okay, here they are. 7 signals that your dry mouth is hiding something bigger. Pay close attention. Signal 1, dry mouth plus a metallic or chemical smell in the morning. This is not normal bad breath. This is a potential kidney function warning. Ask your doctor for a kidney function panel. Signal 2, saliva that feels thick, ropey, or foamy. This is not absence of saliva, it's altered saliva. This is an autoimmune signal. Think Sjogren's syndrome, lupus, or rheumatoid arthritis. Ask for autoimmune screening. Signal 3, dry mouth only at night, but fine during the day. If your daytime feels okay but you wake up parched every single morning, this is a textbook sleep apnea pattern. Your airway is collapsing during sleep and forcing mouth breathing for hours. Ask for a sleep study. Signal 4, dry mouth plus getting up to urinate 2 or more times every night. That combination is a diabetes red flag. High blood sugar pulls water from your tissues, including your salivary glands, while also driving increased urination. Ask for a fasting glucose and HbA1c test. Do not wait. Signal 5, dry mouth plus eyes that feel gritty or dry. This is the signature presentation of Sjogren's syndrome. It affects an estimated 1 in 70 women over 60 and is severely underdiagnosed. It is very treatable when caught early. If missed, it can progress to the kidneys, lungs, and nervous system. Signal 6, dry mouth plus cramping in your legs or feet, especially at night. This combination flags a dangerous electrolyte imbalance, low sodium, potassium, or magnesium. If you take diuretics, this is especially urgent. An electrolyte crisis combined with dry mouth can trigger a cardiac arrhythmia. Call your doctor this week. Signal 7, dry mouth that started within 90 days of a new medication. This is not a coincidence. The 90-day window is when anticholinergic suppression, the kind that shuts down saliva production, typically reaches its clinical threshold. Call your doctor's office and ask specifically for a polypharmacy review. Do not wait for your next scheduled appointment. What you can do right now, 6 clear steps. Step 1, the morning mouth check. Before you drink anything, take 60 seconds. Is there any saliva? Is it thin or thick? Any strange smell? Can you swallow without needing water first? Do this every morning and keep a simple note on your phone. That data is exactly what your doctor needs. Step 2, write down every single medication you take. Every one. Prescription, over-the-counter, supplements. Then look up each one and check for the words anticholinergic or xerogenic. When you see your doctor, say these exact words. I would like to request a formal polypharmacy review focused on my combined anticholinergic burden. Those specific words will change the entire conversation. I promise. Step 3, stop relying on water to fix it. I know that sounds counterintuitive, but dry mouth is not a hydration problem. It's a glandular function problem. Your salivary glands need electrolytes, sodium, potassium, bicarbonate, to produce saliva. Drinking plain water can actually dilute those further. Small sips throughout the day paired with electrolyte-rich foods is far more effective. Step 4. Protect your mouth at night. Elevate the head of your bed 4 to 6 inches. Use proper bed risers, not just extra pillows. Run a cool mist humidifier in your room at 40 to 60% humidity. Use a xylitol-based mouth rinse before you sleep. Never alcohol-based, which only makes dryness worse. Step 5. Stimulate saliva production during the day. Xylitol gum after meals. Sour sugar-free candy to activate your parotid glands. Crunchy raw vegetables at every meal. Carrots, celery, cucumber. These are backed by clinical research. They are simple, inexpensive, and they work. Step 6. Know the emergency signals. If you have dry mouth and difficulty breathing, go to the emergency room now. White patches in your mouth, call your doctor today. That can be oral candidiasis and it needs treatment. Dry mouth with sudden confusion or weakness, call 911. Dry mouth with chest pain or fast heartbeat, call 911. Dry mouth with an unexplained fever, same-day urgent care, do not wait. Let me bring this together quickly. Saliva is your body's frontline defense. When it disappears, dangerous bacteria travel to your lungs, heart, and bloodstream. Over 500 medications cause dry mouth, and taking 3 or more multiplies the damage, not just adds to it. Dry mouth can cause malnutrition even when you're eating normally because digestion starts in the mouth. Bacteria from a chronically dry mouth have been directly linked to heart disease, cognitive decline, and sepsis. Dry mouth is almost never just aging. It is a signal pointing at something deeper, and you deserve to have it investigated. 7 warning signals, 7 action steps, you now have both. If this video helped you understand your own body a little better, or if it made you stop and think, wait, that sounds exactly like me, then please don't keep it to yourself. Share this video with one person over 60 in your life, a parent, a neighbor, a friend from church, your spouse, just one person. You don't need to explain anything, just send it and say, watch this. That 5 seconds could genuinely change something for them. And if you're not subscribed to this channel yet, now is the time. Hit that subscribe button right now. It's free, it takes 2 seconds, and it means you won't miss the next video. Every week, I bring you real, research-backed health information, explained simply and clearly, without the jargon, without the fluff, and without wasting your time. You deserve to understand your own health. That's exactly what this channel is here for. Before I go, drop one word in the comments. Type Margaret if you woke up this morning with a dry mouth and you're taking this seriously, starting today. Type medication if you're on 3 or more prescriptions and you're going to ask for that review. Type doctor if you're bringing this to your next appointment. I read every single comment, and I want to know you're okay. My name is Dr. Eleanor Mercer. Thank you for spending this time with me today. Take care of yourself because you are absolutely worth taking care of. I'll see you in the next video.